Hi everybody, welcome to our presentation. This presentation is on ethical considerations in interprofessional collaboration. In our group, we have Angie, me, Orchid, Micah, and Sophia. We are part of Group 2 in Nursing 671 of Brandman University.
What exactly is ethical interprofessional collaboration? Engel in practice has a very good definition, and that's the optimal use of the skills and knowledge of all health professionals working together as a team to deliver comprehensive integrated care. This is very important as all these individual members of the group are coming together to deliver specialized and personalized care. Very important concept of this is preserving patient collaboration and control of care. Essentially, this means the patient would be an active collaborative entity in the actual group and not just the group deciding for the patient. Teamwork among the various healthcare professionals is definitely needed, and each one obviously has a various background and comes from very different disciplines. Each member of the interprofessional collaborative team is working to their fullest extent with specialized knowledge and skill. A very important of this collaborative is to understand and respect the other member's specialized knowledge and skill, and also understanding that each member does have their own extensive education playing into their role into the interprofessional collaborative group. Two important characteristics are collaboration, like I said before, and the active sharing of knowledge. This differs, whereas to multidisciplinary, there would be not as much active collaboration. What makes this different is that there is active sharing of knowledge and a long more active collaboration within the group. Another important aspect of this interprofessional collaboration is the respect of each member's skill and background, as I mentioned before. Moving into a little bit more detail on the ethical interprofessional collaboration, each professional as part of the group is equipped with ethical norms based on their specific profession. A great concept to understand of this is also not only are we accepting the ethical norms for their specific profession, but also we are respecting the professional and personal norms of each member within the group. The group also has the capability to understand various ethical perspectives, as I said, when considering healthcare practices and, of course, individualized patient care. There is a very big emphasis on communication, again, to prevent the possible power struggles among team members, lack of role clarity, lack of understanding about the roles and scopes of practices of other providers, and stereotyping with regard to other professions. The Interprofessional Educational Collaborative has done a great job on outlining how working together in these settings can end up preventing those power struggles, lack of role clarity, and lack of understanding that all basically come and stem from not actively collaborating with other members. Once we are able to see and learn how other people function, we're able to prevent the possible stereotyping, and this also helps with preventing the creation of preconceived notions, considering that we're actively collaborating with other disciplines. The Interprofessional Educational Collaborative in 2011 pointed out how it values learning together with constant interaction between professions to basically gain a greater understanding of interprofessional care and sharing decision making. I think that's very important to remember, that the most important concept is shared decision making, not only again amongst team members and against between different providers, but also with the patient. The ethical component of the ethical interprofessional collaborative group takes into consideration sensitivity, active encouragement of opinions and ideas of other team members, and again, that's a great example of collaboration, and also the understanding of the uniqueness of self and others and what each can bring to the care of patients. Again, that's more of that's a great definition of what interprofessional collaboration is, just because it highlights the ethical concept of sensitivity, the active encouragement of other opinions and learning from others as team members, and also ultimately connecting it back to patient care. The ultimate underlying theme is working for the greater good of the patients, whether that's one individual patient, their families, or on a bigger scale as a population. Two, basically as a summary for ethical interprofessional collaboration, are the concepts of beneficence, which is working for the greater good, and reminding us that we should always take patient participation into their care as a very, 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 very important concept.
So, how do healthcare professionals ensure that interprofessional collaboration is a daily practice in reality? Well, first, identify individual values. According to Engel and Prentice, collaboration starts with knowing what your values are, both as an individual and as a professional. Then you need to compare it with team values and see if your views are similar to others. When there is a similar values, then there is a better cooperative environment. People tend to naturally work better with those they align with, so ensure your values align with partners' values or team values. You also need supporting characteristic traits for said values. These traits enable daily interaction for interprofessional collaboration. So some of these characteristics are honesty and integrity, humility and fairness, and courage and respect. Engel and Prentice explain that when there is a good fit of moral values within a team or between two professionals, then this ensures a good moral framework for daily team collaboration. To expand on this idea for good teamwork, Engel and Prentice also point out that each member of the team must know and understand not only their own role, but the roles of others. To have interprofessional collaboration, the most important idea is the willingness to be part of an interprofessional team. You need to adopt certain team playing behaviors and attitudes. One such team playing behavior is to keep an open mind of other people's perspective. You can imagine yourself in their shoes and try to understand what they are feeling. This empathizing technique creates a mindfulness of one another's professional skills and role that they undertake. Another technique is easing tension, like using humor. The main idea is that you stay reflective of each other's actions. Again, we can't stress the importance of knowing the roles and skill levels of other healthcare professionals. This idea is essential for interprofessional collaboration. A third technique for team playing behavior is having a genuine and courageous attitude. This is not only for creating an open and honest conversation, but also having that difficult dialogue for addressing ethical barriers. At the organizational level, Eshwan, Perry, and Murphy explain that institutions should start establishing their desired interprofessional collaboration with policies and procedures. Then, education and administration need to support this new idea of interprofessional collaboration. They can align the idea of teamwork amongst professionals. Another ground framing work at the organization level includes a safe team environment. By safe, we mean where people feel respected and the communication can flow easily. Don't forget, open and honest communication enhances collaboration and coordination. Again, even at the organizational level, there needs to be a role clarification, a team function, and who is the leader.
A lot of the ethical issues that arise from the interprofessional collaboration has to do with intrapersonal and interpersonal relationships. According to Overton and Lowry, the first step to resolving conflict is self-awareness. Awareness of your own roles, responsibilities, awareness of stereotypes you've subconsciously held over others, awareness of your own misconceptions about their roles and responsibilities. So if we go back a step, before we reach conflict resolution, let's explore the conflict itself. So, where does interprofessional conflict begin? It usually begins with the intolerance of others' differences. For the purposes of this discussion, I will focus on the biomedical principle of autonomy. We are trained to approach patients with respect for their autonomy, but have we ever associated autonomy when it comes to our colleagues? Have we ever applied the principle of autonomy when approaching our colleagues regarding patient care? Have we ever assessed ourselves if whether or not we respect our own autonomy as part of the healthcare team? When we are faced with diversity in the group, be it differences in beliefs, values, experiences, expertise, culture, or religion, what is our natural inclination? It's certainly not to welcome it without internal struggle, because any change in our environment causes a disturbance within, and acceptance usually requires a proactive change in the mindset. A qualitative study done in 2013 found that autonomy is integral in interprofessional team functioning. Empowering the autonomy of healthcare team members improves the collaborative relationship and interactions. A quantitative study done in 2017 found that increased nurse autonomy is associated with a decrease in a 30-day mortality and failure to rescue in surgical patients. I want to first bring to light, before I discuss the following ethical principles, to notice that intrapersonal and interpersonal relationship is the common denominator between all of them. In 2013, Engel and Prentice stated that professional factors in medical errors that lead to detrimental outcomes include power struggles, lack of understanding about the roles and responsibilities of other healthcare team members, stereotyping, and differences in their perspectives about patient outcomes. According to Ewashin, Perry, and Murphy, biomedical principles require thoughtful justification in judging common moralities and the case it pertains to, which includes the individual, the institution, the culture, and the situation. Relational ethics has four dimensions, and these are meaningful connections, mutual respect, recognition of the body, and the environment that it is in. Similarly, virtue ethics talks about practice reasoning and its requirement for practitioners to be aware and sensitive towards values, beliefs, and deeply held morals for oneself and of others. To summarize this part of the presentation, a violation in the autonomy of oneself and of others negates all these principles that we had just talked about, giving rise to ethical issues and moral conflict in interprofessional collaboration.
In this section, we will discuss how to resolve ethical issues that may arise with interprofessional collaboration. The ability to work with professionals from other disciplines to deliver collaborative, patient-centered care is considered a critical element of professional practice requiring a specific set of competencies. In a study by Suter et al., the authors interviewed 60 healthcare providers from different disciplines. They have concluded that understanding and appreciating professional roles and responsibilities and communicating effectively are the two perceived core competencies for patient-centered collaborative practice. The first core competency is role understanding and appreciation of other roles. It is said that realizing that no single discipline can fulfill all of one patient's needs promoted the desire to collaborate. While it is known that collaboration is vital for effective patient care, a lot of care providers admitted the lack of knowing how to work interprofessionally. And this is due to little understanding of professional roles and responsibilities of others. Disregarding this first core competency can lead to failure in mutual understanding, meaningful communication, and relationships. On the other hand, Realizing role importance will prompt care from provider-driven to patient-centered care. The second core competency is communication. It is said that communication embodies a large range of tactics and purposes. Communication among healthcare providers and patients with their families, whether it be formal or informal, plays a major role in collaborative patient-centered care, and more specifically, in coordination of care. Participants in the study stated that there were occurrences when communication needs to be improved. Other healthcare professionals are not comfortable talking about and outlining what their roles are, which results to role and responsibility misunderstanding. The authors explained that team members need to exhibit cohesiveness and promote a unified opinion when communicating with patients and their families. Moreover, team members must be able to adjust to multicultural communication between patients and other healthcare members. And finally, care providers emphasize the need for a setting that nurtures collaborative practice and promotes collaborative proficiencies to cultivate. Understanding these two core competencies are said to be the most significant in promoting patient-centered collaborative practice. To think that focusing simply on these two core competencies may seem appealing. However, the complexities of the two competencies are significant. Both role understanding and communication are multi-complex and necessitate well-defined learning goals and outcomes.
In conclusion, ethical interprofessional collaboration is a multidisciplinary healthcare team. They work to their fullest capacity of professional training, they share in knowledge, and they respect one another. They also have the patient in control of the care delivered. For daily practice of interprofessional collaboration starts with agreeing with team values and supporting these values with team-playing characteristics like honesty. Interprofessional collaboration starts with administration and education, promoting through policies and procedures. Ethical issues of interprofessional collaboration surround the concepts of inter- and intraprofessional relationships and the intolerance of differences. Ethical issues' root cause is from disrespecting the autonomy of the self and/or others. Resolving ethical issues of interprofessional collaboration come from two core competencies. The first one is the role of understanding and appreciation of others. The second is good communication. These are significant in promoting patient-centered collaborative care. Again, I'd like to thank you guys for listening and being patient with us. This is Group 2 for Interprofessional Collaboration. Thank you so much. Have a good day.